dry eye is really a collection of symptoms, and there are what we call multifactorial causes to the disease. So they're associated with many different external factors, but some of the major ones that are implicated are the environment, hormonal status. So dry eye is more common in women than it is in men, and it is more common in postmenopausal women, as well as factors such as local or systemic inflammation. Various studies have implicated the prevalence in the United States from 5 to 35 million individuals. I think that the use of technology is enhancing some of the worst effects of dry eye. So one of the natural mechanisms that our eye has to lubricate is the blink reflex. And the blink reflex spreads tears and healthy, the different components of tears, the watery layer and the lipid layer evenly across the eye, providing lubrication at regular intervals. And so I think that not blinking when you're sitting in front of a device can lead to irritation of the eye, and once that irritation of the eye starts, that can turn into a persistent irritation or inflammation and perpetuate the process. The most common links or problems exhibited by dry eye patients are corneal ulceration, corneal scarring, the inability of the cornea to heal, because of course a natural tear flow is important in sustaining the health of the cornea. If you experience more than a sporadic dry eye that might be associated with our El Niños, for instance, or with environmental pollution, and if it is persistent over a period of weeks, I would recommend that you go to a physician and get it analyzed. Recently, Shire launched the MyEyeLove campaign with Jennifer Aniston, which I think is a fabulous development as a researcher my whole life in the dry eye field. The website provides tremendous resources for patients with dry eye, and I think that the field has advanced so that there are many options.
USC Laser Vision within the USC Roski Eye Institute provides the latest and greatest care with LASIK and other refractive surgery procedures. Myself and my partners, I'm very proud to be affiliated with this organization at this point because of the great care we provide. LASIK is a wonderful surgery and has tremendous outcomes today for the right patients. One of the annoying side effects early on is some dry eye that's a little bit worse than it was beforehand for most patients. Now this typically goes away over days to weeks. Occasionally patients have persistent dry eye. Fortunately, we have new treatments available for these patients.
I think patients should be prepared to engage in good eye hygiene, good lid hygiene, be prepared to use a lot of over-the-counter artificial tears, and perhaps some stronger prescription medications for the duration of that recovery.